health systems are taking a major focus on population health for a number of reasons. Really you started hearing this more and more with the passing of the Affordable Care Act a number of years ago. And one of the principles of that plan is really a good idea, in that it is saying that, how do we reward healthcare businesses by keeping people healthy, not just treating them when they're sick? So predominantly we have a health system environment that's what's called fee for service, meaning I go see the doctor when I'm sick. I hurt my knee, I go see the orthopedic surgeon. I'm starting to have disease. Those are the things that then generate a lot of money for health systems. Now they're doing a good service, and for healthcare businesses, they're doing a great service by trying to help that person. But that isn't necessarily the dynamic going forward that we want to have to reshape the health system and the outcomes of the health system, because we spend so much money on the healthcare system, but we don't necessarily have good outcomes. So how do we change those outcomes? And so a focus on population health is what that's about. So, value-based care became something that became and still is a big topic with healthcare businesses, because the concept of that was government programs that would allow you to make money by keeping a group of people healthier than the baseline, right? So that is some factor in it. There are ways in which there are government programs from a Medicare perspective, et cetera, to Medicaid, to take advantage of those programs by keeping people healthy, by enacting systems and procedures that do a better job of producing better health outcomes. Now, it's obviously got a lot more reach than that, right? There's a lot of different businesses that are trying to get into healthcare for positive effects. I mean, you'll see people like Walmart Healthcare. Walmart is not a health system, but they are really embracing healthcare, because in a lot of their trade areas, there are people that don't have access to healthcare in a convenient way, that don't have access to certain education or certain access to good foods. So what can a company like Walmart's role be in improving the health outcomes of a population, an underserved population, a population that is potentially outside of maybe Walmart in a food desert, doesn't have strong access to care? What role can they play? And so beyond Walmart, there are other businesses as well that are looking to take a role that will help improve outcomes of a population, and therefore improve the lives of those people. And that's really, frankly, an interesting thing to me, in that, that's obviously altruism, right? How can we do good? But we also live in a capitalist society. So how do we, in some ways, figure out how to combine capitalism and altruism, right? And there are businesses that are looking to do that. And I think if that can be done well and responsibly, that can benefit a lot of people.